There's been quite a bit of activity in Washington the past couple of days focused on offering Americans some relief and help in getting through this crisis. Here to talk about what's being done are Connecticut's two U.S. Senators, Senator Richard Blumenthal and Senator Chris Murphy. And Senators, we thank you so much for being on the program. We appreciate this because I know it's been very busy. You've been going back and forth to Washington to deal with this coronavirus.
Thanks.
But I want to ask you, what specifically is being done in Connecticut to help people back here in Connecticut? And I will start with the senior senator, Mr. Blumenthal.
Well, here's the good news. Although we face a crisis, a whirlwind of really historic proportions, unknown to me, unprecedented in my lifetime, Washington is working to move forward, notwithstanding the delay, which has been intolerable. We've had two bipartisan packages of relief so far. And I would rate the response so far as incomplete because there has been emergency sick leave, family medical leave, unemployment compensation expanded, $440 million of Medicaid aid for Connecticut alone and hundreds of millions more for the country, nutrition assistance, and a number of other very, very important measures. But we still need to put cash into pockets of consumers, families, workers, small businesses, and we need to make sure that student debt is forgiven, that the underpinning of our medical system is strengthened. I went to the Charter Oak Federally Qualified Health Center today, and here's what I heard. They lack enough protective gear to get through another week. In other words, at the end of next week, they won't have enough protective gear for their workers. That is absolutely disgraceful. The lack and lag in testing has been shameful. And I think Americans ought to be very dissatisfied so far with the pace of response.
Senator Murphy, I'll let you weigh in here.
Well, listen, I'm grateful that we live in a generous state. I think people understand the sacrifices we all need to make. I think they're stepping up. I just sent out an email a couple days ago in which I asked for private donations to our two food banks, and within about 24 hours, $100,000 had come in. And so, it's a miracle that we are looking out for our neighbors and we're stepping up as a state. Listen, we are all disappointed at the speed at which this administration has responded, but Dick is right. Congress has been abnormally functional during the last several weeks. We have passed very quickly two major disaster assistance packages, and we're debating a third. I think the only danger here, the thing that I worry about, Dennis, is to not get out ahead of ourselves. The economy is in meltdown, but the economy won't recover unless we tackle the virus first. And so I think we still need to make sure that every hospital, every health center has the resources to combat the virus, that we can identify it properly, because if we get distracted and we don't concentrate on stopping the healthcare problem, then there's nothing we can do to solve the economic problems.
We're all pretty much self-quarantining here. We're going to our homes. We're running out only for groceries. Every business is closed. And yet we're talking to relatives who live in Florida and other states that are wide open. They're going to restaurants. Beaches are open. Do you believe that there should be a national shutdown, a national policy in terms of what's good in Connecticut should also apply in other states?
So I do, and I've thought this for the last month and a half. I've been very disappointed that the CDC didn't create national standards and guidelines. Now, I think the CDC might not have to mandate closures, but if the CDC strongly recommends that a governor take a particular action or a mayor take a particular action, they will follow. And it has really been left to governors and mayors to lead, and what's happened is a patchwork of standards. And even if we were able to beat the virus here in Connecticut, if a state 200 miles away can't beat it, then we're still in jeopardy. So I'd like to see more national standards, at least more strong national recommendations.
And I agree that there has to be a national response with national standards. Part of the national response ought to include the military. And as a member of the Armed Services Committee, I've talked to some of the military leadership who are eager to use the vast resources, and they have medical supplies, protective gear that could be used, ventilators, masks. These supplies are in very, very short order, and also the Defense Industrial Production Act, which dates to the Korean War. The president signed an executive order, but he still hasn't directed, for example, General Motors laid off all its workers for at least 2 weeks. It could turn its supplies and assembly line to produce those ventilators.
Well, we heard the governor say that we don't have enough ventilators here. What senators, can you do perhaps to get some of these from the military brought to Connecticut?
we can take the lead on the Armed Services Committee, and it's not just Connecticut, it is nationwide, in making sure that military resources are used, not without sacrificing our national defense, not compromising our national security, but this disease really is a matter of national security. It is an economic whirlwind that puts America in a world of hurt. I've talked to small businesses that are literally struggling, and they need that cash infusion, not just loans, but grants. Mitch McConnell today came out with a proposal that I consider inadequate. I hope it provides a basis for negotiation. It should be bipartisan, and we're going to work hard, I think, to try to reach bipartisan consensus.
I want to talk about this idea with a $2,000 cash payment to all Americans. Should it be different for the single mom with 3 kids at home? Should she perhaps get more? Should someone who has money not necessarily get a check?
So I proposed a few days ago, and I think Senator Blumenthal supports this proposal, to get $2,000 to every American and then $2,000 additional dollars for every child. I think it should be income capped, but I think they should be relatively generous income limits. We've proposed about $100,000 for individuals, $200,000 for families. And yes, you can have a very nuanced discussion about who needs more, who needs less. The difficulty is the economy is hemorrhaging right now, and we need to get this money out the door as quickly as possible so that families can be whole and then put that money into the Main Street economy. And so I think we want to be careful not to spend weeks getting caught in the weeds and understand that there is an urgency of action. I want to go big here. The proposals out there range from $500 to $1,500. I really think that we should be talking about $2,000, $4,000, $6,000. You don't want to make a mistake by going small here and having tens or hundreds of thousands of businesses shuttering their doors and never opening again.
And to answer your question directly, Dennis, there are ways to, in effect, impose income and means and other kinds of tests so that millionaires and billionaires don't receive $1,000. But if we're going to err, let's make sure that cash goes into that economy. And there are ways to do it so that you do prevent excess and abuse, using the unemployment compensation system. Put it on steroids. Expand it so that it's an employment compensation system, and businesses are not burdened. And likewise, forgive student loan debt so that they have more cash in their pockets. But small businesses are the backbone of our economy.
We have to take a quick time out. More with Senators Murphy and Blumenthal in just a second. And as we head out, we want to check out our instant Vote Now poll on what viewers think about the federal response. So how are you rating it? Let's take a look at the responses we've been getting. So 10 indicates the response is excellent, 1 is poor, and right now we are looking at pretty much split. Is that correct? 1 poor, 10 excellent, and the average is 5. So that's not very good. We got 7 for state response, 5 for the federal response. More with the senators after this quick timeout.